with me. Today we're discussing something many people know they should do but struggle with: reapplying sunscreen throughout the day. You apply sunscreen in the morning carefully and thoroughly. You feel protected. But as the hours pass, that protection diminishes. Sunscreen breaks down, wears away with sweat and touch, and gradually loses effectiveness. Reapplication isn't optional. It's essential for continued protection. The standard recommendation is to reapply every 2 hours of sun exposure. This isn't arbitrary. Studies show that most sunscreens, even water-resistant ones, lose significant effectiveness after 2 hours of continuous UV exposure. Chemical sunscreens break down as they absorb UV radiation. That's literally how they work. They absorb rays and convert them to heat. But this process gradually degrades the active ingredients, reducing protection over time. Physical sunscreens are more stable, but they can still rub off, be diluted by sweat, or settle into skin creases, creating gaps in coverage. Additionally, most people don't apply enough sunscreen initially. We use 25 to 50% of the recommended amount, meaning our actual SPF is much lower than the bottle claims. Reapplication helps compensate for this initial underapplication, so reapplication is crucial. But how do you actually do it, especially over makeup in the middle of your day? Let's explore practical reapplication strategies for different situations. If you're bare-faced or wearing minimal makeup, reapplication is straightforward. Gently blot away excess oil with blotting paper if needed. Apply your sunscreen just as you did in the morning. A generous amount massaged gently into your skin. Let it absorb briefly before resuming activities. Keep a tube of your favorite sunscreen in your bag, car, or desk drawer. Make it accessible so reapplication becomes easy and automatic. But what if you're wearing full makeup? This is where reapplication gets tricky, but remains important. Powder sunscreens are designed for reapplication over makeup. These are loose or pressed powders with SPF that you can dust or pat over your makeup without disturbing it. They provide a quick protection boost and can even mattify shine. However, be realistic about powder sunscreen limitations. It's difficult to apply enough powder to achieve the labeled SPF. Think of it as supplemental protection rather than complete coverage. It's better than nothing, but not quite as effective as cream reapplication. To use powder sunscreen effectively, apply generous amounts, more than feels natural. Use a kabuki or powder brush for loose powder or the provided puff for pressed powder. Press and roll the powder onto your skin rather than sweeping it. Focus on high exposure areas: forehead, nose, cheeks, and chin. Sunscreen setting sprays are another option for makeup wearers. These are mists containing SPF that you spray over your face to refresh protection. Like powder sunscreens, they're convenient but have limitations. The challenge with spray sunscreens is application control. It's hard to know if you've applied enough, and much of the product can drift away rather than landing on your skin. You also need to ensure even coverage. If using sunscreen spray, close your eyes and mouth, hold the bottle 6 to 8 inches from your face. Spray generously in a continuous motion, covering your entire face. Then pat it gently with clean hands to ensure even distribution. Spray in a well-ventilated area and avoid inhaling the mist. Sunscreen sticks offer another convenient reapplication method. These solid balms in stick form allow you to swipe sunscreen over makeup without using your hands. They're portable, mess-free, and easy to apply targeted protection to high-exposure areas. Apply sunscreen sticks in multiple layers, swiping back and forth several times to build adequate coverage. The portability makes them perfect for tossing in your purse or pocket. Some people prefer to remove makeup, reapply cream sunscreen, then touch up makeup. This ensures the most thorough protection but requires more time and effort. If you're outdoors all day, at the beach, park, or outdoor event, this might be worth doing. For those working indoors with limited sun exposure, reapplication strategy can be more relaxed. If you're inside with minimal window exposure most of the day, one morning application might suffice for typical daily life. But for any extended outdoor time, even a lunch walk or afternoon errands, reapplication matters. If you work near windows or have significant UV exposure indoors, reapplication remains important. UVA rays penetrate glass, and chronic exposure adds up to premature aging and skin damage. Consider your individual sun exposure when determining reapplication frequency. Continuous outdoor exposure requires strict 2-hour reapplication. Intermittent sun exposure, being outside briefly throughout the day, might not require such rigid timing, but you should still reapply if you'll be outdoors for extended periods. Water activities demand more frequent reapplication. Even water-resistant 80-minute sunscreen should be reapplied immediately after swimming, toweling off, or heavy sweating. Water-resistant doesn't mean waterproof. The sunscreen will gradually wash away. If you're swimming or sweating heavily, reapply every 40-80 minutes depending on your sunscreen's water resistance rating. Better yet, be conservative and reapply frequently. You can't over-apply sunscreen when you're in the water. For outdoor activities like hiking, sports, or yard work, reapply every 2 hours minimum or more frequently if you're sweating heavily. Keep sunscreen easily accessible so you remember to reapply. Let's discuss specific body areas that need reapplication attention. Your face, neck, ears, and chest are usually well covered by morning application and reapplication. But people often forget their hands, forearms, and any other exposed skin. Hands in particular need frequent reapplication. We wash them multiple times daily, removing sunscreen each time. Apply sunscreen to the backs of your hands after washing them, especially if you'll be driving or spending time outdoors. If you're in the car frequently, you might want to keep a small tube of sunscreen in your car for easy hand and arm reapplication before driving. Left side sun damage from driving is real and cumulative. The scalp is another often forgotten area. If you have thinning hair or a receding hairline, protect your scalp with hat, sunscreen spray, or powder sunscreen designed for hair scalp use. Let's address the mental and habit-forming aspects of reapplication. The biggest barrier isn't logistics, it's remembering to do it and overcoming the inconvenience. Set alarms on your phone if you'll be outdoors for extended periods. A 12 p.m. and 2 p.m. reminder can prompt midday reapplication. Build reapplication into existing routines. Reapply after lunch or when you take an afternoon break or before leaving work if you'll be driving with sun exposure. Keep multiple sunscreens in different locations: your purse, car, office desk, gym bag. Accessibility removes excuses. Choose reapplication products you genuinely like using. If your powder sunscreen feels nice and looks good on you, you'll use it. If your sunscreen stick has a pleasant texture, reapplication becomes less of a chore. For
hyperpigmentation. Results are more dramatic than superficial peels but carry higher complication risks. Most people perform medium peels quarterly rather than monthly. Deep peels penetrate deeply into the dermis, providing maximum results but requiring significant recovery time. These use very high acid concentrations, TCA at 50% plus, or phenol. Recovery takes weeks, and results are essentially permanent in terms of skin transformation. Deep peels carry significant risks and are rarely performed for acne specifically, being more appropriate for severe aging or significant scarring. Most dermatologists reserve deep peels for carefully selected cases. Laser treatments use focused light energy to treat acne, scarring, and pigmentation. Different wavelengths target different structures. Ablative lasers, CO2, erbium YAG, remove skin layers through vaporization, providing maximum results but requiring weeks of recovery. Non-ablative lasers penetrate without removing skin, requiring less recovery but multiple treatments. Fractional lasers treat portions of skin, leaving untreated skin to support healing, requiring less recovery than full laser treatment. For acne specifically, fractional non-ablative lasers are most commonly used. These provide acne improvement through collagen remodeling and pore minimization without severe downtime. Typical treatment plans include 4 to 6 treatments spaced 4 to 6 weeks apart. Results appear gradually over months as collagen remodels. Fractional laser is excellent for acne scarring, pore size reduction, and texture improvement. Cost is typically $300 to $800 per treatment. Blue light therapy uses specific light wavelengths, around 415 nanometers, to kill acne-causing bacteria. Treatments are painless, require no downtime, and are suitable even for sensitive skin. Most treatment plans include 8 to 12 treatments performed twice weekly. Blue light is particularly valuable for antibacterial acne treatment without systemic antibiotics. Cost is typically $75 to $150 per treatment. Photodynamic therapy, PDT, combines a photosensitizing agent, topical aminolevulinic acid or methylaminolevulinate, applied to skin with subsequent light activation. PDT kills bacteria, reduces sebum production, and improves acne. Treatments are followed by 24 to 48 hours of photosensitivity and significant redness. Results are dramatic but require recovery time. PDT is reserved for severe acne resistant to other treatments. Radiofrequency, RF, treatments deliver radiofrequency energy deep into skin, stimulating collagen, reducing sebum production, and improving acne. Multiple treatments are necessary, typically 4 to 6 treatments spaced 3 to 4 weeks apart. Radiofrequency is gentle, requires no downtime, and is suitable for various skin types. Results include both acne improvement and skin tightening. Microneedling creates controlled microinjuries triggering collagen production and skin remodeling. For acne, microneedling improves scarring and texture. For active acne, microneedling isn't appropriate as it can spread bacteria. Once acne is controlled, microneedling helps with residual scarring. Typical treatment plans include 3 to 4 treatments spaced 4 to 6 weeks apart. Microneedling is relatively affordable, $200 to $400 per treatment, compared to laser treatments. Extraction treatments remove comedones professionally. Hydrofacial uses suction and infusion to extract impurities without harsh manual extraction. Regular professional extractions by experienced estheticians safely remove comedones impossible to remove at home. Some dermatologists perform extractions as part of acne management, particularly when comedones are resistant to topical treatments. Intralesional steroid injections treat individual cystic acne lesions directly. A small amount of corticosteroid is injected into the cyst, causing rapid deflation and healing within days. This prevents cysts from persisting weeks or months and dramatically reduces scarring risk. Cost per injection is typically $25 to $75. This is not a treatment for widespread acne but rather for occasional large cysts. When considering professional treatments, assess treatment suitability for your specific concerns. Is your issue active acne, scarring, texture, or some combination? Different treatments address different concerns. Realistic expectations are essential. Even professional treatments require multiple sessions and gradual improvement over months. Budget considerations matter. Professional treatments can be expensive. Discuss your goals, budget, and expectations with your dermatologist. Combination professional approaches often yield best results. Monthly superficial chemical peels combined with quarterly fractional laser treatments, for example, address multiple aspects of acne and scarring simultaneously. Your dermatologist can recommend an appropriate combination for your specific situation. Guide 16: When to see a dermatologist, recognizing acne severity and treatment failure. Knowing when to seek professional dermatological help prevents prolonged acne suffering, psychological distress, and permanent scarring. Several clear indicators suggest you should see a dermatologist. Severe widespread acne covering large areas of your face and body warrants dermatological evaluation. Extensive acne suggests a need for systemic treatment beyond what topical treatments typically achieve. Dermatologists can prescribe oral medications, hormonal treatments, or isotretinoin, Accutane, for severe cases. Numerous cystic acne lesions, particularly if they're large, painful, and prone to scarring, require professional intervention. Cystic acne rarely responds adequately to topical treatments and often requires intralesional steroid injections, oral antibiotics, or other systemic treatments. Treatment failure after 8 to 12 weeks of consistent appropriate treatment suggests your acne requires professional intervention. If you've conscientiously followed a good skincare routine with proven treatments like benzoyl peroxide, salicylic acid, and retinoids for 8 to 12 weeks without significant improvement, your acne likely requires prescription treatments or systemic medications. Rapid acne onset or sudden severe acne worsening in adults may indicate hormonal imbalances, medication side effects, or other medical conditions. Professional evaluation can identify underlying causes and recommend appropriate treatment. Women experiencing sudden severe acne should be evaluated for PCOS or other hormonal disorders. Acne causing significant psychological distress, depression, anxiety, or social withdrawal warrants professional intervention regardless of acne severity. Mental health impacts justify professional dermatological treatment. Acne with signs of infection, increasing warmth, swelling, pus drainage, fever, requires prompt medical attention. These signs may indicate infection beyond typical acne and require professional assessment and possibly antibiotics. Acne concentrated on your body, back, chest, shoulders, and resistant to typical acne treatments may indicate fungal acne or other skin conditions requiring professional diagnosis and treatment. Concerns about permanent scarring or hyperpigmentation justify professional consultation. Early professional intervention can prevent or minimize scarring through aggressive treatment or appropriate professional therapies. During a dermatology visit, be prepared to discuss your acne history, previous treatments.
Welcome to this peaceful space of learning and care. Take a deep, nourishing breath, hold it for just a moment, and then release it slowly. Let your shoulders drop. Let tension melt away. Today we're going to talk about something absolutely fundamental to skin health that doesn't get nearly enough attention: your skin barrier and how to keep it healthy and strong. Your skin barrier is the unsung hero of your skin's health. It works tirelessly, 24 hours a day, protecting you from the outside world and keeping your skin functioning optimally. Yet it's often invisible in its work. You only really notice it when it's damaged and stops working properly. Today, we'll learn to understand, appreciate, and care for this remarkable protective system. Let's begin by understanding what your skin barrier actually is. Your skin has several layers, and the outermost layer, the one you can see and touch, is called the stratum corneum. This is your skin barrier. Think of it like a brick wall. The bricks are dead skin cells called corneocytes, and the mortar holding them together is a mixture of lipids, ceramides, cholesterol, and fatty acids. When this wall is intact and strong, it performs two crucial functions beautifully. First, it keeps the good things in: water, moisture, and the structural components that keep your skin healthy. Second, it keeps the bad things out: bacteria, irritants, pollutants, and allergens. A healthy barrier means healthy, comfortable, resilient skin. When this barrier is compromised or damaged, everything changes. Water escapes more easily, leaving your skin dehydrated. Irritants penetrate more readily, causing sensitivity and inflammation. Your skin becomes reactive, uncomfortable, and unable to maintain its optimal state. Many skin concerns that seem unrelated actually stem from barrier damage. Let's explore what a healthy skin barrier looks like and feels like. Healthy barrier skin feels comfortable. It's not tight, not itchy, not irritated. It feels soft and supple to the touch. When you apply products, they absorb comfortably without stinging or burning. Your skin tolerates changes in weather reasonably well. It doesn't react dramatically to most products. It maintains its moisture throughout the day without becoming excessively dry or oily. It has a natural, subtle glow, not oily shine, but healthy luminosity. Healthy barrier skin also recovers well from minor insults. A pimple heals without becoming a major drama. A slight scratch or irritation resolves quickly. Your skin has resilience and bounce-back capacity. This resilience is the hallmark of a strong barrier. Now let's understand what damages your skin barrier, because prevention is always easier than repair. Over-cleansing is one of the most common culprits. When you wash your face with harsh cleansers, use very hot water, or cleanse too frequently, you strip away the natural lipids that form your barrier's mortar. Your skin's pH also becomes disrupted. This leaves your barrier weakened and porous, unable to retain moisture or protect adequately. Overexfoliation is another major cause of barrier damage. In our quest for smooth, glowing skin, many people use exfoliating products too frequently or too aggressively. Physical scrubs, chemical exfoliants like AHAs and BHAs, and exfoliating tools all remove the surface layer of your skin. Used judiciously, this can be beneficial. Used excessively, it destroys your barrier faster than your skin can repair it. Environmental stressors take their toll as well. cold, dry winter air, hot, dry indoor heating, air conditioning, sun exposure without protection, wind, pollution. All of these assault your skin barrier daily. While you can't avoid all environmental stress, you can minimize exposure and support your barrier's ability to withstand it. Harsh products with irritating ingredients also compromise your barrier. High concentrations of alcohol, fragrances, essential oils, and certain harsh actives can all irritate and damage your barrier over time, especially if your skin is already compromised. Using too many products, even if individually gentle, can overwhelm your skin. Each product requires your skin to process and respond to dozens of ingredients. When you layer many products, you're asking your barrier to handle hundreds of ingredients at once, which can weaken it through sheer overwhelm. Stress, poor sleep, and inadequate nutrition affect your barrier health as well. Your skin barrier repairs itself primarily while you sleep. When you're chronically sleep deprived, this repair process is compromised. Stress increases inflammation throughout your body, including your skin. Poor nutrition deprives your skin of the building blocks it needs to maintain its barrier. Now let's talk about how to keep your barrier healthy through daily practices and choices. The foundation of barrier health is gentle cleansing. Choose a mild pH-balanced cleanser that removes impurities without stripping your skin. Your cleanser should leave your skin feeling clean but comfortable, never tight or squeaky. Avoid cleansers with sodium lauryl sulfate, which is particularly harsh. Use lukewarm water, never hot. Cleanse thoroughly but gently, without aggressive scrubbing. Most people only need to truly cleanse once per day, in the evening. In the morning, many skin types can simply rinse with water. This prevents over-cleansing and preserves your skin's natural oils. Moisturize faithfully and appropriately. Your moisturizer is your barrier's best friend. It provides both hydration and the lipids your barrier needs to function optimally. Look for moisturizers containing ceramides, which are a key component of your skin's natural barrier. Fatty acids, cholesterol, and niacinamide are also excellent barrier-supporting ingredients. Apply moisturizer to slightly damp skin. This helps seal in that extra water and supports your barrier's hydration. Don't be stingy with moisturizer. Use enough to cover your face and neck comfortably. Protect your skin from the sun every single day. UV radiation damages your barrier directly and creates inflammation that weakens it over time. Broad-spectrum sunscreen is essential barrier care, not optional. Be extremely cautious with active ingredients and exfoliation. If you use retinoids, AHAs, BHAs, or other actives, introduce them slowly and use them sparingly. Start with once or twice a week and only increase frequency if your skin tolerates it well without irritation. Never use multiple actives at the same time or on consecutive days until your skin has proven it can handle each one individually. Consider taking breaks from actives periodically to let your barrier rest and repair. Your skin doesn't need constant treatment with powerful ingredients. Sometimes it just needs gentle support and space to maintain itself. Layer your products thoughtfully. Thinner, water-based products go first, followed by thicker, oil-based products. This allows each layer to penetrate appropriately. Give each product a moment to absorb before applying the next. Rushing and layering too quickly can prevent proper absorption and overwhelm your barrier. Support your barrier from within. Drink adequate water throughout the day. Eat foods rich in omega-3 fatty acids, salmon, walnuts, flax seeds, which support your skin's lipid barrier. Ensure you're getting enough essential vitamins and minerals, particularly vitamins A, C, and E, and zinc, all of which support skin health. Prioritize sleep. This is when your barrier repairs itself most effectively. Aim for 7 to 9 hours of quality sleep nightly. If you're consistently sleeping less, your barrier will struggle to maintain itself regardless of what products you use. Manage
severe acne. Preventing antibiotic resistance through early intervention with non-antibiotic treatments preserves antibiotic effectiveness if future antibiotics are needed. Starting with topical treatments rather than immediately jumping to oral antibiotics is prudent prevention approach. Education about acne myths prevents harmful behaviors. Teaching teenagers that acne results from poor hygiene, untrue, chocolate causes acne, unproven, or picking helps, false, prevents reinforcing these myths. Accurate education supports evidence-based prevention. Professional guidance for high-risk individuals might include dermatology consultation for those with strong family histories or early acne onset. Early professional involvement can prevent severe acne development. Guide 60, Acne Maintenance After Successful Treatment, the Forever Routine. Once you've achieved clear skin after acne treatment, maintaining clarity requires ongoing commitment to maintenance. Understanding long-term maintenance distinguishes between temporary acne control and permanent clear skin. The first principle of maintenance is recognizing that acne tendency doesn't disappear, it's managed. Your skin's predisposition to acne remains, but with appropriate ongoing treatment, acne stays controlled. This is similar to maintaining any chronic condition. You don't stop managing diabetes once blood sugar is controlled, you maintain management indefinitely. Maintenance routines are typically simpler than treatment routines. While treatment might involve multiple actives used frequently, maintenance often involves fewer treatments used less frequently. For example, someone might use salicylic acid daily and benzoyl peroxide daily during treatment, but maintain clear skin with just retinoid at night and benzoyl peroxide spot treatments as needed. Identifying essential treatments through your treatment experience guides your maintenance routine. Which treatments were crucial to your success? Continue those indefinitely. Which were helpful but not essential? Consider dropping these if your skin tolerates it, simplifying your routine while maintaining clarity. Seasonal adjustments remain important long-term. Winter might require slightly more moisturizing or reduced exfoliation frequency. Summer might require increased sun protection. These adjustments maintain skin health across seasons. Stress management, sleep, diet, and other lifestyle factors remain important long-term. While you might relax some during periods of stability, reverting entirely to poor habits causes acne recurrence. Maintaining reasonable health habits supports ongoing skin clarity. Monitoring your skin regularly allows early detection of potential recurrence. Monthly self-assessments identifying any new breakouts allows you to intensify treatment immediately if needed, preventing minor breakouts from progressing to significant acne. Having your dermatologist's contact information and willingness to contact them if acne recurs despite maintenance allows quick professional intervention. Don't try to solve recurrent acne alone for months, get professional help quickly. Keeping maintenance products on hand prevents running out and missing treatments due to product unavailability. Some people order backup products when current products are half empty, ensuring continuity. Reframing maintenance as self-care rather than burden improves adherence long-term. Your skincare routine is caring for your body's largest organ, supporting not just appearance but overall skin health and barrier function. The ultimate goal of maintenance is such consistency that skincare becomes automatic, habitual, and integrated into your daily routine like brushing teeth. At this point, maintaining clear skin requires minimal conscious effort. Guide 61: Understanding acne in specific sports and athletic activities. Different sports expose athletes to different acne triggers. Understanding sport-specific acne patterns allows targeted prevention and management for athletes. Swimming exposes skin to chlorine and often tight, non-breathable swimwear. Chlorine is drying and irritating, worsening acne. Frequent swimmers often experience acne on face, chest, and shoulders. Prevention includes rinsing thoroughly after swimming, removing chlorine quickly through gentle cleansing, using moisturizer afterward to combat dryness, and wearing clean, breathable clothing after swimming. Contact sports, football, wrestling, rugby, involve friction, pressure from equipment, and contact with other players' skin and bodily fluids. Helmet friction often causes severe acne along helmet edges. Prevention includes ensuring equipment is clean, using protective barriers, adhesive tape, where possible, showering immediately after contact, and maintaining aggressive acne treatment during the season. Running and jogging cause profuse sweating and friction from clothing. Prevention includes wearing moisture-wicking, breathable clothing, showering immediately after exercise, cleansing sweat off before acne develops, and using lightweight, non-comedogenic sunscreen resistant to sweat. Cycling involves friction from tight cycling clothing and helmet wear. Prevention strategies similar to other sports apply. Weightlifting and resistance training involve pressure from equipment, sweat, and friction. Focusing on cleanliness of equipment, showering immediately after workouts, and changing into clean clothes prevents sweat-related acne. Yoga and other activities with face-on-mat contact, yoga, Pilates, certain exercises, can cause acne if mats aren't clean. Using personal mats, washing them regularly, and avoiding touching your face during exercise helps. General athletic acne prevention across all sports includes showering within 1 to 2 hours after exercise, not wearing sweat-soaked clothing longer than necessary, cleansing face, neck, and areas covered by equipment, using clean towels, maintaining aggressive acne treatment during athletic seasons when acne tends to worsen. Working with dermatologists familiar with athletic acne helps develop sport-specific prevention and treatment plans. Some athletes benefit from temporary treatment intensification during seasons when their sport-specific acne triggers are highest. Guide 62: Acne treatment during immunosuppression and immune compromise. Immunosuppressed individuals, those with HIV, on immunosuppressive medications, with certain diseases, experience altered acne patterns and treatment responses. Managing acne in immunocompromised individuals requires special considerations. Severe acne with unusual presentations can indicate immune compromise in some contexts. If acne is unusually severe, doesn't respond to standard treatments, or has atypical features, immune status should be assessed. Immunosuppression can paradoxically worsen or improve acne depending on the specific immune alteration. HIV infection, particularly with low CD4 counts, is associated with worse acne and unusual presentations. Improving immune function through antiretroviral therapy often improves acne. Immunosuppressive medications, for transplant, autoimmune disease, or other conditions, sometimes worsen acne through various mechanisms. Managing acne in immunosuppressed individuals requires careful coordination with prescribers to avoid interactions and ensure appropriate acne treatment. Live bacterial vaccines are contraindicated in immunosuppressed individuals. This limits probiotic supplement options in severely immunocompromised people to non-viable probiotics, postbiotics, fermented foods. Isotretinoin should be used cautiously or potentially avoided in severely immunocompromised individuals due to risks of severe side effects and reduced healing capacity. However, isotretinoin can be used in mildly immunocompromised individuals with appropriate monitoring. Standard topical acne treatments are generally safe in immunocompromised individuals, though infection risk from acne, commonly known by its former brand name Accutane, represents the most powerful acne treatment available. It's the only medication that can potentially cure acne permanently. However, its serious potential side effects mean it's reserved for severe, treatment-resistant acne and requires careful medical supervision. Understanding isotretinoin, its mechanism, effectiveness, requirements, and side effects, is essential for anyone considering this treatment. Isotretinoin is a vitamin A derivative, but far more potent than over-the-counter retinol or even prescription tretinoin. It works through multiple powerful mechanisms. First, it dramatically reduces sebaceous gland size and sebum production by up to 90%, essentially eliminating one of the 4 primary factors in acne development. Second, it normalizes follicular keratinization, preventing dead skin cell accumulation that leads to comedones. Third, it has powerful anti-inflammatory effects, reducing the inflammation driving acne. Fourth, it has some antibacterial properties, reducing Cutibacterium acnes populations. The combination of these mechanisms makes isotretinoin extraordinarily effective. Approximately 70 to 90% of patients achieve complete, long-term acne remission after 1 course of isotretinoin. Many patients are cured permanently, their acne never returns. Of those who do experience some acne recurrence, it's typically mild and easily manageable with topical treatments, a vast improvement from their initial severe acne. Isotretinoin's effectiveness is why it's considered the gold standard for severe acne. The trade-off of potential side effects is justifiable when dealing with acne severe enough to cause permanent scarring or significant psychological distress. However, isotretinoin is teratogenic, meaning it causes severe birth defects if taken during pregnancy. This is the primary reason for its strict regulation and monitoring requirements. Any woman of childbearing age must use 2 reliable contraception methods while on isotretinoin and for 1 month after stopping. Monthly pregnancy tests are mandatory. This requirement, while burdensome, has made isotretinoin a reasonably safe option when guidelines are followed. Isotretinoin requires enrollment in the iPledge program in the United States. This program mandates monthly office visits, monthly laboratory tests, and strict documentation of contraception use for women. Prescribers must be registered, pharmacies must be registered, and patients must comply with all requirements. While this oversight seems excessive, it exists to prevent the tragic scenario of a teratogenic medication being used during pregnancy. Typical isotretinoin dosing is 0.5 to 1.0 mg/kg daily, with cumulative dosing targets of 120 to 150 mg/kg for optimal outcomes. A person weighing 70 kilograms might receive 35 to 70 milligrams daily. Treatment duration typically lasts 4 to 6 months, depending on dosing and individual response. Higher cumulative doses correlate with lower relapse rates. Common side effects of isotretinoin include severe dryness affecting skin, lips, and mucous membranes. Lip dryness is nearly universal. Most patients require intensive lip balm use throughout treatment. Dry skin often requires frequent application of heavy moisturizers. These side effects, while uncomfortable, are manageable. Using a humidifier, applying moisturizer multiple times daily, using occlusive lip balms, and using artificial tears for dry eyes all help manage these effects. More serious potential side effects include birth defects, hence the strict contraception requirements, elevated liver enzymes, elevated triglycerides, requiring dietary management or medication, depression and mood changes, inflammatory bowel disease, and rare severe reactions. These serious side effects necessitate baseline laboratory testing, monthly laboratory monitoring, and careful symptom assessment. Any concerning symptoms should be reported to your dermatologist immediately. Depression and mood changes are particularly concerning. While actual isotretinoin-induced depression is rare, patients do report mood changes, and there's ongoing debate about causation versus correlation. Patients with personal or family history of depression should discuss this risk carefully with their dermatologist. Many dermatologists don't prescribe isotretinoin to patients with untreated depression or psychiatric conditions, or do so with additional psychiatric monitoring. Isotretinoin can cause temporary initial acne worsening, flaring, as sebaceous glands adjust and dead skin cells are shed. This flaring is temporary and can be managed with topical treatments or low-dose oral corticosteroids in severe cases. Muscle and joint pain occur in some patients, typically mild but sometimes bothersome. This side effect often improves with continued use or resolves after treatment stops. Who is an appropriate candidate for isotretinoin? Severe nodular acne with risk of scarring is the classic indication. Acne resistant to maximum dose oral antibiotics combined with topical retinoids for at least 3 to 4 months is another strong indication. Any acne causing significant psychological distress or affecting quality of life substantially is also appropriate. Recurrent acne after previous isotretinoin course might be retreated with isotretinoin, though some dermatologists reserve retreatment for specific circumstances. The process of obtaining isotretinoin involves consultation with a dermatologist willing to prescribe it, understanding all requirements and side effects, baseline laboratory testing, and enrollment in iPledge. For women, establishing contraception plan is necessary. Once established on isotretinoin, compliance with monthly visits and laboratory tests is mandatory. Noncompliance results in treatment discontinuation. Cost is a consideration. Isotretinoin itself is relatively inexpensive. The original brand Accutane is expensive, but generic isotretinoin is affordable. However, the required monthly visits and laboratory tests add significant cost. Insurance typically covers isotretinoin for severe acne, but coverage varies. Discussing cost with your dermatologist before starting is important. Results from isotretinoin are remarkable. Most patients experience dramatic acne improvement within 1 to 2 months, with near-complete clearance by 3 to 4 months. The persistence of results years after treatment completion is what makes isotretinoin special. Most other treatments require ongoing use for results to persist. Post-isotretinoin skin care involves using gentle products, as skin is often more sensitive after treatment. Many patients can use minimal skin care after isotretinoin, though some benefit from occasional retinoid maintenance to prevent any acne recurrence. Most patients can essentially stop acne-focused skin care and use only basic skin care and sunscreen. Isotretinoin should not be your first treatment. Attempting appropriate topical treatments, salicylic acid, benzoyl peroxide, retinoids, and potentially oral antibiotics for several months should precede isotretinoin consideration. However, if you have severe acne causing scarring risk or significant distress, don't suffer for years without considering isotretinoin. Discuss it with your dermatologist if you have severe, resistant acne. Guide 22, Oral Antibiotics for Acne, Types, Mechanisms, Resistance, and Long-Term Management. Oral antibiotics have been acne treatment staples for decades, effectively controlling moderate to severe inflammatory acne. Understanding antibiotic options, their effectiveness, the critical issue of antibiotic resistance, and appropriate usage patterns is essential for optimal acne treatment. Oral antibiotics treat acne through multiple mechanisms. First, inflammatory effects. Many people, particularly those in northern climates or those who avoid sun exposure, have vitamin D deficiency. Supplementing vitamin D at 1000 to 400 IU daily improves acne in some individuals, particularly those with low baseline levels. Testing vitamin D status can help identify deficiency. Selenium deficiency affects immune function and skin health. Adequate selenium, 55 to 200 micrograms daily, supports skin health. However, acne-specific benefits of selenium supplementation aren't definitively established. Iron deficiency, particularly in menstruating women, can affect overall skin health and healing. Severe iron deficiency anemia causes various health problems including poor wound healing and immune dysfunction. However, iron supplementation for non-deficient people doesn't improve acne. Vitamin A, retinol, deficiency causes follicular hyperkeratinization and immune dysfunction contributing to acne. However, toxicity from excess vitamin A is also problematic. Getting adequate vitamin A through diet, liver, sweet potato, leafy greens, is ideal. Supplementing vitamin A is only necessary if deficient. B vitamins, particularly B5, pantothenic acid, are promoted for acne at very high doses, 10+ grams daily. However, evidence is weak and high-dose B5 causes diarrhea frequently. Normal B vitamin intake through diet or multivitamin supplementation supports general health without special acne benefits. Omega-3 fatty acid deficiency promotes systemic inflammation worsening acne. Getting adequate omega-3s, 1 to 2 grams EPA plus DHA daily from fish or supplements, supports skin health through inflammation reduction. Identifying nutritional deficiencies, blood testing can assess status for most nutrients. Dietary assessment helps identify if diet provides adequate nutrients, considering supplementation if deficiencies are identified. However, supplementing without deficiency rarely provides additional benefit. Getting nutrients through food when possible is preferable to supplementation. Guide 56, Occupational Acne Syndromes, Tar acne, Oil acne, and Chemical exposure. Workers in certain occupations experience acne specifically from occupational chemical exposures. Understanding occupational acne helps you implement prevention strategies and pursue appropriate treatment. Tar acne develops in workers exposed to coal tar, crude oil, and petroleum products. Mechanics, road workers, and petroleum industry workers are susceptible. Tar acne results from follicular occlusion and irritation from these substances. Appearance is often on exposed areas, hands, face, neck, forearms. Oil acne develops in workers exposed to mineral oils and cutting fluids in metalworking, automotive work, and similar occupations. These oils are comedogenic and occlusive, clogging pores and promoting acne. Oil acne is often quite severe if exposure is chronic. Chloracne results from exposure to chlorinated hydrocarbons in chemical manufacturing. This is rare, but when occurs, is severe. Chloracne is characterized by cystic acne and systemic symptoms from toxic chemical exposure. Prevention strategies for occupational acne include wearing protective equipment, gloves, long sleeves, face protection when possible, washing thoroughly at end of work shifts to remove chemicals from skin, changing out of contaminated clothing immediately, using workplace-provided safety measures and equipment, discussing with employers if exposures can be reduced or if different equipment can minimize exposure. Treating occupational acne while reducing exposures through workplace modifications is important. Standard acne treatments combined with occupational hygiene improvements provide best results. Workplace legal considerations matter if acne results from unsafe occupational exposures. In some jurisdictions, occupational skin diseases are covered under workers' compensation. Documenting occupational exposure history and acne onset can establish occupational causation. Guide 57, Asian Skin, Rosacea, and Acne in East Asian Populations. East Asian skin has specific characteristics affecting acne presentation and treatment response. Understanding these characteristics improves acne management in East Asian populations. East Asian skin often has different lipid composition and barrier characteristics compared to other populations. Some evidence suggests East Asian skin has higher ceramide content but different lipid organization, affecting both barrier function and acne development. Rosacea is increasingly recognized in East Asian populations, though historically was underdiagnosed. East Asian rosacea often presents as acne-like lesions, acne rosacea, potentially confused with bacterial acne. Recognizing rosacea as distinct from acne ensures appropriate treatment selection. Sebaceous gland characteristics may differ slightly across ethnic backgrounds, though individual variation exceeds group variation. Treatment intensity might require individualization based on individual skin characteristics rather than ethnic background. Post-inflammatory hyperpigmentation is very common in East Asian skin and requires aggressive prevention and treatment. Sun protection is particularly important. PIH treatments, vitamin C, azelaic acid, hydroquinone, are particularly relevant. Barrier function support might be particularly important for East Asian skin in certain climates. Adapting treatment intensity and moisturizing based on individual response rather than population averages is most accurate approach. Guide 58, Acne in LGBTQ+ populations, Hormone Therapy and Transition-Related Acne. Transgender and non-binary individuals receiving hormone therapy often experience acne changes related to hormonal transition. Understanding these changes helps manage acne during transition. Testosterone-based hormone therapy, for transmasculine individuals, typically worsens acne initially due to increased androgens. Acne often develops or significantly worsens during the first 1 to 2 years of testosterone therapy. This is particularly challenging for individuals already prone to acne. Aggressive acne prevention and treatment during testosterone initiation is important. Some individuals benefit from starting acne treatment prophylactically before or as testosterone therapy begins. Estrogen-based hormone therapy, for trans feminine individuals, typically improves acne over time as androgens are suppressed. Many trans feminine individuals experience significant acne improvement within several months to a year of estrogen therapy. This improvement can be dramatic and psychologically significant. Spironolactone, commonly used alongside estrogen therapy for anti-androgen effects, has acne beneficial effects. The combination of spironolactone plus estrogen provides maximal acne improvement in trans feminine individuals. Timeline for hormone therapy acne effects is important to understand. Acne worsening from testosterone therapy might persist 1 to 2 years before stabilizing or improving. Setting realistic expectations prevents discouragement during this period. Psychological impact of acne during transition deserves acknowledgement. Acne during transition, when someone is often already managing significant life changes and body image adjustments, can cause additional distress. Aggressive acne management acknowledges this psychological weight. Working with dermatologists and endocrinologists familiar with transgender health improves care. Some clinicians are specifically experienced in managing acne in hormone therapy contexts. Guide 59, Acne Prevention in Acne-Prone Individuals, True Primary Prevention. True primary prevention prevents acne from developing in susceptible individuals before breakouts occur. While this doesn't apply to those already experiencing acne, understanding prevention helps younger individuals or those with family history prevent severe acne. Risk factors for developing acne include family history, strong genetic component, male sex, higher baseline androgens, and adolescent/young adult age. Individuals with all three risk factors have highest acne development risk. Primary prevention strategies include skincare routines starting in early adolescence, gentle cleansing, sun protection, use of non-comedogenic products, education about acne triggers and prevention, stress management techniques learned early, healthy diet emphasizing whole foods, adequate sleep, limiting skin trauma, not picking at skin, avoiding aggressive products. Non-comedogenic product selection starting early prevents product-induced acne. Teaching teenagers to evaluate skincare products and cosmetics prevents years of unnecessary acne from products. Early intervention at first signs of acne prevents progression to severe acne. Starting mild treatments, salicylic acid cleanser, at the very first breakout often prevents acne from worsening. This early treatment is simpler than treating established severe acne. Preventing antibiotic resistance through early intervention with non-antibiotic treatments preserves antibiotic effectiveness if future antibiotics are needed. Starting with topical treatments rather than immediately jumping to oral community health workers trained in acne management can provide guidance and treatment in areas lacking specialist dermatology. Telemedicine potentially extends access to professional dermatology even in resource-limited areas, though internet access is necessary. Simple, low-cost interventions, sun protection, hygiene, lifestyle optimization, remain effective even without expensive treatments. Guide 85, Acne and Gender, Sex-Specific Differences and Considerations. While acne affects all genders, sex-specific hormonal and social factors create gender differences in acne experience warranting gender-specific understanding. Female acne often involves hormonal cyclicity, often concentrating around menstrual cycle phases. Males lack this cyclicity, experiencing more constant acne patterns. Hormonal treatments, oral contraceptives, spironolactone, are standard for female acne but generally inappropriate for males. Males rely on topical treatments and antibiotics primarily. Female-specific acne considerations include menstrual cycle tracking, potential birth control side effects, and pregnancy precautions with acne medications. Male acne might be more severe on average due to higher baseline androgens. However, severe acne affects all genders. Facial hair in males makes treating acne challenging. Beard covers facial acne and prevents topical treatment application. Facial hair also traps moisture and bacteria. Some males benefit from beard care modifications or shaving strategy adjustments. Societal appearance pressure affects genders differently. While appearance standards affect all genders, women might face intensified appearance-focused judgment. Recognizing gender differences allows appropriate, gender-sensitive treatment approaches. Guide 86. Acne Scarring Prevention During Active Treatment. While scarring is addressed post-acne, prevention during active acne treatment is more effective than treating scars after they form. Preventing deep inflammation, which causes scarring, is paramount. Aggressive acne treatment preventing severe lesions prevents scarring more effectively than treating scars afterward. Avoiding picking, squeezing, or extracting acne is crucial for scarring prevention. This is perhaps the single most important scarring prevention strategy. Treating acne early prevents it from reaching severity levels causing scarring. Early intervention prevents worse scarring than treating established severe acne. Professional acne management, particularly using isotretinoin for severe acne, prevents deep inflammation that causes scarring. Waiting years trying home treatments before seeking professional help allows scarring to occur that could have been prevented. Post-inflammatory hyperpigmentation prevention through sun protection prevents darkening of healing acne that makes scars more visible. Barrier health maintenance during treatment prevents excessive irritation that might promote deeper inflammation and scarring risk. Understanding that scarring prevention is more effective than scar treatment motivates appropriate early intervention for severe acne. Guide 87. Acne and Beauty Standards, Challenging Appearance-Focused Culture. Acne exists within broader cultural beauty standard contexts. Understanding and challenging appearance-focused culture helps reduce acne-related distress. Beauty standards have varied historically and culturally, showing that current standards are culturally constructed, not universal truths. Overemphasis on flawless appearance in media and advertising creates unrealistic expectations. Recognizing that almost everyone has occasional skin imperfections helps maintain perspective. Influencer and celebrity appearance standards are curated through makeup, filtering, professional photography, and often procedures. Comparing yourself to these unrealistic standards damages self-esteem. Diverse beauty standards across cultures show multiple ways to be beautiful. Recognizing beauty beyond clear skin reduces acne's psychological impact. Challenging personal internalized beauty standards, recognizing you can be valuable and attractive with acne, reduces acne-related distress. Supporting others in valuing themselves beyond appearance helps shift culture away from appearance obsession. Advocating for more realistic, inclusive beauty standards in media reduces social pressure perpetuating appearance anxiety. Guide 88. Acne Treatment Adherence and Habit Formation Science. Understanding adherence and habit formation improves your ability to maintain treatment consistency long-term. Habits typically form through repetition. Repeating skincare routines consistently for 2 to 3 months makes them increasingly automatic, reducing conscious effort required. Environmental design supporting habits increases consistency. Placing skincare products visibly, creating dedicated skincare spaces, and removing friction, having products easily accessible, supports adherence. Cue-based habit formation, attaching skincare to existing habits like brushing teeth, increases consistency compared to time-based cues. Remember to do skincare. Reward associations with skincare, pleasant-smelling products, enjoyable ritual, positive reinforcement, increase adherence through positive conditioning. Accountability partnerships where you report to someone, friend, family, online community, increase consistency through social commitment. Motivation fluctuates. Understanding that motivation naturally varies and developing systems that work regardless of motivation, habit, routine, environment design, helps maintain adherence despite motivation fluctuation. Self-compassion toward occasional lapses prevents them from derailing entire routines. Missing a day occasionally doesn't mean failure. Restarting immediately prevents occasional lapse from becoming permanent abandonment. Guide 89, Acne and Sensory Sensitivities, Managing Treatment for Sensitive Individuals. Individuals with sensory processing sensitivities, common in autism, ADHD, and sensory processing disorders, might struggle with standard skincare routines. Adaptations help these individuals maintain treatment compliance. Sensory preferences vary individually. Some find strong scents overwhelming, others find unscented products leaving no sensory feedback. Understanding your sensory preferences guides product selection. Texture sensitivities affect product tolerability. Lightweight serums might feel pleasant while thick creams feel cloying. Smooth absorbing products feel better than sticky formulations. Temperature sensitivities might affect water temperature for cleansing. Some prefer cool water, others slightly warm, never hot, which damages skin. Routine predictability helps sensory sensitive individuals. Critically affected by anabolic steroids, which cause severe acne, through testosterone suppression effects, though acne treatment itself doesn't affect male fertility. Untreated severe acne might indirectly affect fertility through mental health impacts and reduced relationship satisfaction. Treating acne supports fertility planning outcomes. Guide 96, Acne and Alcohol Use, Interactions and Effects. Alcohol affects acne through multiple mechanisms. Understanding these relationships helps you make informed alcohol decisions. Alcohol increases inflammation and dehydration, both worsening acne. Excessive alcohol consumption notably worsens acne in most people. Alcohol consumption patterns matter. Occasional moderate alcohol probably has minimal skin effects. Chronic excessive consumption significantly worsens acne. Some acne medications interact with alcohol. Isotretinoin with alcohol increases liver toxicity risk. Antibiotics with alcohol sometimes cause nausea and reduced effectiveness. Alcohol increases cortisol and stress, indirectly worsening acne through hormonal pathways. Alcohol disrupts sleep quality, indirectly worsening acne through sleep deprivation effects. Dehydration from alcohol increases skin dehydration, contributing to compensatory sebum production and acne. For optimal acne management, minimizing alcohol consumption is beneficial. This doesn't require complete abstinence for most people, but reducing consumption supports acne improvement. Guide 97, Acne and Smoking, Direct and Indirect Effects on Skin. Smoking worsens acne through multiple mechanisms, making smoking cessation valuable for acne improvement. Smoking increases inflammation systemically, promoting acne. Smokers have higher acne prevalence than non-smokers. Smoking impairs immune function, reducing your body's ability to fight acne-causing bacteria. Smoking impairs wound healing, increasing scarring risk from acne lesions. Smoking damages skin barrier function, increasing irritation and acne risk. Secondhand smoke exposure, while less harmful than direct smoking, also worsens acne through similar mechanisms. Smoking interferes with many acne medications. Some medications have reduced effectiveness in smokers. Smoking accelerates skin aging, creating double damage, worse acne plus premature aging. Smoking cessation, beyond its general health benefits, often improves acne significantly. Many former smokers notice acne improvement within weeks to months of quitting. For optimal acne management, smoking cessation is highly beneficial if applicable. Conclusion: your acne treatment journey. Congratulations on completing this comprehensive 100-guide exploration of acne science, treatment, and management. You now possess extensive knowledge spanning from basic acne biology through emerging treatments and personalized optimization strategies. Remember these core principles as you move forward. 1. Acne is treatable. Whatever your acne severity, treatment exists. You can achieve clear skin. 2. Consistency matters more than perfection. Maintaining a routine 90% of the time beats perfect adherence for 2 months than abandonment. 3. Your acne is unique. Treatments that work for others might not work for you, and vice versa. Personalizing based on your response is important. 4. Professional help is valuable. Dermatologists can identify problems you might miss, recommend optimal treatments, and provide professional therapies beyond home care. 5. Mental health is legitimate. Acne's psychological impact is real. Addressing it matters as much as treating physical acne. 6. Lifestyle factors matter. Sleep, stress, diet, and exercise significantly affect acne. Optimizing these supports treatment success. 7. Early intervention prevents complications. Treating acne promptly prevents severe acne and scarring that would result from delayed treatment. 8. Long-term maintenance matters. Achieving clear skin isn't the finish line. Maintaining clarity requires ongoing appropriate management. Your acne journey is unique to you. Some people achieve clear skin with simple topical treatments. Others require comprehensive professional management including systemic medications. Both paths lead to clear skin. Whether you're just starting acne treatment, struggling with treatment-resistant acne, or maintaining achieved clarity, you now have comprehensive knowledge to guide your path forward. Clear skin is achievable. Your dedication to understanding your acne and implementing appropriate treatment will lead you there. Best wishes on your acne-free future, potentially safe during pregnancy. Topical salicylic acid used in small amounts and limited areas. Large-scale systemic absorption possible though typically minimal. Topical azelaic acid, generally considered safe. Topical clindamycin. Some dermatologists recommend avoiding, though others consider it relatively safe. Sulfur-based products. Considered relatively safe historically. Most conservative approach during pregnancy. Gentle cleansing only, avoiding all active acne treatments unless absolutely necessary. Many dermatologists recommend waiting to treat acne aggressively until after pregnancy or after breastfeeding concludes if planning to breastfeed. If acne must be treated during pregnancy due to severity or psychological impact, consultation with both your obstetrician and dermatologist ensures treatments are appropriately selected based on risk-benefit analysis specific to your pregnancy. Sometimes treating severe acne is justified despite medication risks if the psychological impact is severe. Post-pregnancy acne sometimes occurs as hormones shift after delivery. Many women tolerate this temporary worsening with the knowledge it typically resolves within months. Breastfeeding considerations. Most topical acne treatments are safe during breastfeeding as systemic absorption is minimal. However, discussing specific medications with your healthcare provider ensures safety.